We're good. Good to go.
Okay, great.
Would you like me to do an introduction?
Oh, that'd be great.
Okay,
Thank you.
your girls. All right, everyone, welcome. Thank you so much for being here tonight. We're really excited to bring you some awesome content today. Dr. Anna is one of my favorite educators. She not only has a is a tremendous wealth of information and knowledge, she also, I believe, t walks her talk. And when you are with her, she has such an amazing presence about her that I think you guys are going to really get to experience today. She also has tools that are so implementable to what the things that you're struggling with in your life right now. She is a board certified OBGYN and an expert in anti-aging and integrative medicine. As the founder of the Girlfriend Doctor, she has spent over 20 years helping millions of women navigate hormone health, menopause, and sexual wellness through her clinical practice, online content, and best-selling books, including The Hormone Fix, Keto Green 16, and Menopause. Deeply committed to women's empowerment, Dr. Anna Cabeca uses evidence-based whole person approaches rooted in real clinical experience to help women optimize their metabolism, understand their hormones, and reclaim their vitality. And with that, I'll there you go. You're all you.
Yay. Hey, I'm excited to be here. Carrie, thank you so much for being here and being such an advocate for women's health and being willing to discuss the taboo for whatever reason, so much when it's come to hormones, aging, menopause, and the results of have become taboo. And I want to preface this like menopause is natural, and if we're blessed to go through it, it's amazing. Suffering is optional, right? Suffering is optional. And I think that's what I want everyone to understand, especially as we're working with our clients, as we're navigating this time ourselves. There is so much that we can do to optimize our transitions through menopause. This is what I've really been studying for the last 30 years. And God has a sense of humor, so helped me experience many aspects firsthand. And I'm a problem solver. I had to address the underlying issues, solve the problems, and that's where I created programs and products and content to help everyone go through this. And so I'll share a little bit about my background and story, and I'll keep an eye on the chat if you have specific questions that come up. I'll definitely take some questions at the end. And I will share a little bit. Actually, I'm going to impromptu share some slides. I may jump around a little, but if that's okay, Carrie, I'll go ahead and share my screen. I want to share a little bit about the critical changes that are happening in women's health and why it's so important. And I'll address some questions and parts of the journey too. And I will just start with understanding what our hormones are doing as we age. And so, when it comes to menopause, we have there's a lot of news and media. And for me, being in the space for so long, I've seen the pendulum swing in so many ways, right? The pendulum has swung in so many ways. But I want to be really clear. Women's health has to be approached from an integrative approach, not symptom directed medical care, right? It is an integrative approach addressing the underlying issues that are happening. And menopause is no more a disease process than puberty. So we don't want to suppress it, right? We don't want to, operate people out of it. We don't want to do and medicate people out of it. We don't want to do that. We really want to support. And I find the only way I can do this is from an integrative and functional approach, addressing the underlying issues that are creating this transition, right? We can do it well, we can do it not so well. And so I want to be sure to make that point. Okay, and now let me share my slide. So, right, we think of menopause, the one of the symptoms of menopause that some people, majority of women experience is the hot flashes. And, this is one way to self-medicate, right? So we want to address the underlying reasons what's happening here. And so, as understanding our hormonal shift as we age, from age 35 to 50, I want to really point out this time period because this is that gray shaded, sometimes called an estrogen dominant experience versus progesterone deficiency. But you can see by this graph, this diagram, again, these hormones are not to scale by blood concentrations. But if you look in it, just to be clear, this is to scale. Progesterone and DHEA in the blood circulating are 100 times more dominant than testosterone, which is this black line, and estrogen, which is this pink line. Estrogen is small but mighty, getting a lot of attention. But it's this progesterone piece that I want to focus on now. So just for purpose of visualizing this area, and I know some of you are on your phone, but hopefully you can see this. Progesterone declines by 75% from age 35 to 50, and estrogen declines by 35% from age 35 to 50. So what we see here as ovarian function starts to decline because we get a majority of our progesterone from the ovaries and the adrenal glands, so predominantly. So as ovarian function starts to decline, we get this dip in progesterone. And look at these symptoms that are associated with this. I like to call it progesterone insufficiency, right? There's a little out of balance here because so many things deplete our progesterone bucket. Can I just talk cortisol, for instance? But stress, for instance, multitasking, all the jobs we have, all the hats we wear, and we only have one head, just as a reminder. So lots happening here that further decline, that creates this even more dynamic decline in progesterone. But look at the symptoms, the PMS, and typically with PMS, and as a gynecologist, women coming in their 30s with PMS symptoms, the irregular cycles, the breakthrough bleeding. Often I start to see that in women in their 30s. So standard medicine has taught us, okay, this is where you need to give them SSRI and a birth control pill, right? But we know that is not addressing the underlying issues of what's happening here. So, early on, we see that shift in that decline in ovarian function, and we start to see that neurologic symptoms, the PMS, that one of the most unspoken symptoms, that's a really big clue, is if you hate your partner 2 weeks out of the month. If it's only 2 weeks, it's most likely your hormones, not necessarily your partner, right? So we start to see that decrease in progesterone, and I'll show you the cascade of hormones. But from progesterone, we need progesterone to keep tryptophan active, right? And tryptophan converts to 5-HTP, which makes serotonin. We also need estrogen to support serotonin production and receptors. But it's starting here with the progesterone to keep tryptophan the precursor to make serotonin. And this is something that's not explained well. But digging into the research and understanding this hormonal cascade becomes so, so important. So we can elevate by increasing tryptophan in, heavy foods, add in support for the adrenals first, and then adding additional progesterone. And that's really going to support these neurologic symptoms, the anxiety, the mood swings, the irritability, the, hate your partner, hate your life type symptoms. The monster that comes out of nowhere, like, why did I overreact like that? These are all neurologic symptoms, the brain fog, the mood swings, all of these are neurologic symptoms. And this period, this gray zone, is really better named a period of neuroendocrine vulnerability. Neuroendocrine vulnerability. And through therapeutic lifestyle changes, we can address 90% of this, 90% of this. And Carrie's heard me say this before. I am still a triple board certified physician. I got to at least claim they need me for 10% of it, right? So probably closer to 99% is in our clients' hands. And but adding this additional support and understanding, okay, what do we need to do to navigate this time period? So the irregular bleeding, the PMS symptoms that lead people onto birth control pills, and then as the irregular heavy bleeding that leads people to an endometrial ablation and hysterectomy. And then what happens? We refer them out to, we're done as a gynecologist, right? We're done. So we refer them out to a good psychiatrist, and a divorce attorney because we've not addressed the underlying issues. And it's so important to address the underlying issues that are happening because when we do, 90% of these symptoms go away. And this is what I want to share with you. And again, this is a graph to kind of show you DHEA for both men and women peaks in our 20s and then starts to decline. So we see this adrenal from DHEA. What do we make? Testosterone and estrogen. So mother hormones, progesterone and pregnenolone, converting to down one pathway to DHEA to make testosterone and estrogen. So supporting these higher level hormones is really first step, the adrenals and progesterone and pregnenolone. And then adding in testosterone and estrogen, typically in that order. But when I do hormones, and I'm happy to answer specific questions regarding hormonal replacement there, bioidentical hormone replacement there, because the only hormones that we need to be prescribing are bioidentical, is also clearing the receptor sites, empowering the body and glands and the microbiome to use and produce these hormones more effectively, right? We need to do that in conjunction with, and when we're ever considering replacing, or I like to say replenishing hormones. I don't want to replace what your body's making. I want to replenish and support you. And there's a difference in psychology when you're talking to patients about that. We don't have to replace, we want to replenish. And there's a way we do this from an integrative and functional approach. Now, I told you those symptoms are neurologic. I want everyone to understand this because as I figured this, as I implemented the TLCs, right, therapeutic lifestyle changes, and figured this out in my own life, I was able to really understand what was happening. And this was from a publication in 2015 looking at glucose metabolism in the brain. And we see in perimenopause, this gold line, a significant decline of glucose metabolism in the brain. And estrogen in the brain has been studied thanks to Lisa Mosconi and her work. But if you look at that decline, what does that look more like? Looks more like the progesterone decline. And we know progesterone's a neuroprotective hormone, right? It is neuroprotective. It's not just a hormone for the uterus. It's not just to prevent endometrial cancer on HRT, right? It is a neuroprotective. It helps with memory. It helps with mood. It helps with bones and breast. It's an incredible hormone. So as progesterone and estrogen start to decline in perimenopause, glucose metabolism in the brain decreases. So your brain is starving for fuel. And this black line are all those symptoms here under this in this box, are all those menopausal symptoms that are associated with syndrome of menopause is what they want to call it. I'm like, please stop labeling women's health with syndromes. Please stop giving us more syndromes to deal with. Let's just address the underlying issues, right? Mitochondria, energy, cellular health, glucose metabolism, insulin sensitivity, decreased inflammation, and we've got it. And that's what I found in my own experience, and why I built out what's called my keto green method. So keto standing for getting into ketosis, to burning ketones over glucose, at least periodically, because glucose metabolism in the brain uses glucose or ketones. But ketones, the use of ketones in the brain is not hormone dependent. And I want to share, really emphasize this, because when I started initiating the keto green method with my clients, they would tell me my hot flashes went away. I have better memory. My mood is better. I feel at home in my body again, right? Because this is about getting into ketosis. And the green part is the alkalinization, decreasing inflammation, decreasing cortisol. That is key, adding the key nutrients for the microbiome, adding the nutrient support dietarily for the gut microbiome, for for estrogen detoxification. All of those things became really important. So if we think about that and say, okay, we shift at least periodically to using ketones for fuel, and that's not bacon and butter keto. This concept for keto green is getting your body into ketosis through some carb restriction, intermittent fasting, no more snacking, becoming more insulin sensitive and fuel efficient. And there's a healthy way to do it. And I created medicinal menus as part of these plans from Keto Green in each of my books and my programs. This is the concept: medicinal menus, intermittent fasting, and not crazy intermittent fasting, because that can increase our cortisol, and also periodic feasting. We've got to keep metabolically flexible. So that's an important piece. So this concept of what is happening is that we shifting and understanding that it's a metabolic problem. It's a metabolic issue. Our body's becoming more efficient to sustain us in our latter years so that um, you know, so that we survive, right? We survive in times of scarcity. That's very efficient, but it's not very conducive to our American way of living, that is for sure. So the keto green method was born out of understanding this and partly my own journey. And I'll just share briefly that I'm not naive to the struggles that women have at all. At 39 was diagnosed with infertility and then failed several rounds of the highest available injectable fertility meds, and was then diagnosed with early menopause and told I would never be able to conceive again. And then through my own journey and the grace of God, reversed early menopause and naturally conceived the child I was told I would never be able to have when I was 41 years old. So that lit me on fire to really understand this and help women achieve the same. And then at 48, around 46 to 48, I was struggling again. I had been over 240 pounds, lost 80 of those pounds, and was able to keep them off for a significant amount of time. But here at the mid 40s, that weight gain without doing anything different happened to me. I gained 5, 10, 20 pounds literally overnight without doing anything different. I've been in practice a long time. And so as a young physician, when patients would come in and say, Dr. Ann, I'm literally gaining weight without doing anything different, I'm like, okay, well, are you sure you're not doing anything different? Are you less active? Is there a Snickers bar in your purse? I mean, what's going on? We'll check your thyroid. We'll do these things, but, surely you have to be doing something different, right? And you can't keep doing the same things and expect different results. And because we're naturally becoming more insulin resistant during this time period, as progesterone decreases, we're actually becoming more insulin resistant. And that contributes to that. That's one of the things that contributes to the weight gain without doing anything different. So understanding that, it made a big difference. And so as I gained this 20 pounds, and anyone listening who has lost a significant amount of weight and then starts to gain weight again, I thought, like, oh my God, I'll be 300 pounds before this weight, before it stops. Like, what's happening here? So I went strict keto, strict carb restriction, but I knew I wasn't feeling good. And I was a single mom of three young kids at home still. And I was like, okay, this can't be good. So I did what many of you probably tell your clients to do, and that is check my urine pH. And my urine pH was as acidic as the pH paper read. So I was like, oh my God, I'm peeing acid. And as a functional medicine provider, we know the research that an alkaline urine is associated with bone protection, cardiometabolic protection, cancer. And so I immediately started focusing on adding the alkalinizers, adding the greens, the alkaline bone broth, and realizing that as I was checking my urine pH basically every time I used the restroom, realizing that the mornings that I started the day with my gratitude journaling, my prayer meditation, a walk on the beach, that I was more alkaline each day. So I with a background in physiology, I went to the research, and it showed that stress, cortisol, increases hydrogen ion secretion across the renal tubules. So you're basically creating an acidic urine, which for women, we do not need that in our bladder. not for short term, definitely not for long term. Checking urine pH is one of the important biomarkers to keep our bladder healthy, among other things, right? Incontinence, UTIs, urgency symptoms. We want to keep that bladder healthy. Acid in anything, in a container of anything, is going to erode it and cause damage. So we want to avoid that. So it's really important to look at this from a gynecologic point of view as well as a holistic provider point of view. So as I started doing this, I lost 18 of the 20 pounds within 6 weeks. And I had the peace that surpasses all understanding, it says in the Bible. I was like, okay, I'm still a single mom, and my kids are all going in three different directions all the time. But I had this peace. And as I got healthier, as I had more peace, they did too. Nothing in my external environment had changed, but it felt so much better. And so this is so important. And your patients, your clients, you will experience the same thing as we improve our physiology. So decreasing inflammation, improving insulin sensitivity, focusing on alkalinity and oxytocin increasing behaviors. You'll hear me talk about oxytocin a lot because talking about stress management is just stressful. I mean, who needs to manage anything else at this stage of our lives? So focus on increasing oxytocin, what's fun, what brings you joy, what brings you pleasure. That is where cortisol is the most acidifying hormone. Oxytocin is the most alkalinizing. And I would hear from my clients who were doing my keto green plan in my magic menopause program. They're like, Dr. Anna, I had this great night out with my friends and we were laughing and doing all this stuff. And because my urine was so alkaline all the next day, right? That's amazing. That's a huge shift. That's a huge shift versus, look, I'm eating everything right and I'm eating all these great macrobiotic foods and all organic and all this stuff. And I'm so stressed out and angry at everyone. And your urine's very acidic, right? We cannot, attitude, physiology, mindset all comes into play here. And it is one of the biggest life lessons. So I wanted to share a little bit about that background with you and talk about that. And Carrie, are there any questions that are coming up about this? Because then I do want to definitely dig more into hormones and pelvic vaginal health, which is really one of my areas of passion for sure.
Yeah, no, but I'm glad that you definitely brought that up about the oxytocin. It's always such a good reminder, and so much of I see one of our staff members is on here, how much we see in our practice every single day. So many just overstimulated, like not taking good care of themselves, not setting good boundaries, and not understanding how deeply that's impacting their physiology. So I'm really, really glad that you brought that into the
Yeah,
conversation.
yeah. As I started shifting in my patient base too, and I started asking them, what do you do for fun? And encouraging them to incorporate something for fun, it made all the difference. And I'll give you the example of one of my patients, a young 40-year-old mom of three kids under 7 at home, running errands, anxious, can't remember anything, has her phone on record half the time. And during our office visit, she'd have her mom on so her mom can take notes so she could remember what we talked about in our office visit. I mean, I worked on detox, worked on mold issues, and functional medicine, right? Too. So I worked on all of these issues, hormone balancing, and I finally asked her, I said, what do you do for fun? She goes, I'm managing my kids, I'm doing all these things. And said, well, what did you used to do for fun? She goes, well, what really lights you up? She goes, I used to love to dance. And she goes, actually, there's a place after I drop my kids off at school, which is a dance studio, and I've been thinking about going in there. I said, I highly encourage it. The next time she came back in was like 2 months later for her follow up. She'd lost 10 pounds. She was happy. Her mom was not on her phone. Her mom was not on her phone. She was like, just had this other aura, smiling, eye contact, all these really good social cues. And I said, okay, well, what are you doing different? She goes, I started taking dance lessons 2 times a week. And that was such a powerful reminder to me, right? It's such a big because we're biohackers and oh, we just have to, when we wake up and our keto coffee and our all these supplements and all these things, get in the sauna, do this, do that, right? All these, how to manage my stress. Let me get in some meditation time right now. Oh God, I'm feeling stressed already just by doing this, by talking about this. And we just had to switch it. And that was such a powerful reminder. Like we have to bring joy, we have to bring fun, we have to bring play and pleasure back into our lives. And she says, she says, I don't have any anxiety. I'm able to handle things. I, I did in my 20s. I feel so much better in so many ways. And, you could just see. And I'm like, well, do you need to call your mom to take notes? She goes, I got it. I got it. And it was just such a powerful reminder. So oxytocin, the most powerful hormone, any prescription is incomplete without focusing on this piece, this oxytocin increasing piece. Yes, we can prescribe it too, but we have the best pharmacy within us and we make it within our body. So tapping into that again brings the power back where it belongs. We have been trained as a patient in a medical society to give your power away to your provider, to your insurance company, to to pharma. And this time we take our power back. So I know I'm talking to the choir here, but this is such an important piece. Like this is what I want. I want you to feel empowered in your body, and the choices we make every day, we get to choose towards health or towards disease. And so that is a really big piece of what helps us help our patients and become really successful in these ways. So I wanted to definitely talk about that piece. And let's see here. The other thing I wanted to show you too, because a clue is I looked at this research that was published in 2014. And this showed, I want to share this research with you because it looked at the headlines were hysterectomy increases your risk of diabetes. Okay, and so of course I dug into the research and I was like, I looked here, this top line is no hysterectomy or oophorectomy, so a very uh, lower incidence of diabetes. Oh, wait, hold on. Let me look at these lines. This bottom line is no hysterectomy or oophorectomy. It's supposed to be gray. This black line is if you've had your ovaries removed. And this dashed line is if you've had a hysterectomy but maintained your ovaries. So it shows you that if you've had a hysterectomy and or removed your ovaries, you have significantly increased risk of diabetes. Well, I ask you, is it the hysterectomy and removal of the ovaries that caused the diabetes? Or was it the underlying inflammation and insulin resistance that created the GYN problems that led a person to get a hysterectomy? And I say this as a GYN. As I address the underlying functional issues, created hormone, I say address the devil's pitchfork, inflammation, hormone imbalance, adrenal dysfunction. As we address these issues, and part of that is right, that inflammation piece, the insulin resistance piece, right, the adrenal cortisol piece. So as I address these issues, I went from doing 2 to 3 surgeries per week to needing to do 2 to 3 major surgeries per year. So saved a lot of uteri, saved a lot of uteri and ovaries. And that makes a difference because the longer we retain our ovaries, the better quality of life. Now, if you have clients, if you have had your ovaries removed or a hysterectomy, it just means get more insulin sensitive, decrease inflammation, increase oxytocin, address those underlying issues. And now you're addressing the underlying problems that are happening. Okay. I want to pause for a second because I know I'm covering a lot of areas and I want to just check in. Um, any questions that are coming up for anyone? And because I would love to get in. Katrina said, any tips on lowering sex hormone binding globulin? Oftentimes, sex hormone binding globulin is high either because of inflammation and actually insulin sensitivity that can increase sex hormone binding globulin. So those feast days, making sure you break fast earlier in the day, that can make a difference. And that those are some things that can definitely help. And then supporting your receptor sites and decreasing inflammation in your body. Those are things that can help decrease the sex hormone or normalize, let's say, normalize SHBG. So let's see. It said post-malaria. Free testosterone is increasing. Much of my sex hormone binding globulin is in the 180s. So I would definitely look at your adrenal glands in this situation. Katrina, is just looking at your adrenal glands, creating more insulin sensitivity, and then supporting DHEA as well could help. And the way you're taking the testosterone could make a big difference. Let's see. Okay, so we go into another area again along the same lines, but one that I'm so passionate about is the okay, so termed, vaginal health and pelvic health, and the issues of terms, genitourinary syndrome of menopause. Again, another syndrome. So, and I was really happy that they renamed PCOS to but then they called it, the what do they call it? Polyendocrine metabolic ovarian syndrome. I'm like, please, do we have to call it another syndrome? I mean, you got the metabolic, but what's going on here? Our PCOSers, PMOSers have the warrior genes. You're designed for feminine. You're designed to be a leader. You're designed to build muscle. We're just in a crappy environment to do so. So you have to change the environment. This is the epigenetic piece. All my PCOSers, PMOSers, we want to term it, are designed to be leaders, right? Are designed to build muscle, are designed to, really thrive. So we are. So I hate that this is labeled as a syndrome. If anything, it should be the Amazonian, um, or the Pocahontas genes or this whatever. We really think about it that way. And when I talk
Love
to
that.
yeah, when I talk
So
to
true.
young patients that are coming in, I'm like, okay, and I think of their ethnic background too. What you have these amazing warrior genes, right? Like you are designed to be out in nature, not sitting behind a desk and a computer and eating carbs. You're just not. So, yeah, they are amazing, amazing genetic potential. So, but they feel like they have obesity and acne and infertility genes. That's the wrong message. They
That
think,
reframe is so good.
yeah, and it's so important. It's so important. Okay. So I want to share an area that I'm really passionate about and then I'll take questions, Carrie. So I'll cover this for the next 10 minutes. Does that sound good?
Sounds great. Do you prefer that they drop their comments in the chat and we'll come back to those? Or,
Yes.
okay,
Yeah.
perfect.
Yeah.
All right.
And then also if they raise hands or however you want to do it.
Perfect. Okay.
Okay, so vaginal atrophy or genitourinary syndrome of menopause, however you want to call it, the natural changes of aging. And look, y'all, I have laugh lines, smile lines. I'm 60 this year. I do all my good skincare and I eat face exercises and all that stuff. It's so important, right? That how we show up, the pelvic health, vaginal health, the same loss of elasticity, et cetera, that we're paying so much attention to up here is happening down there. It's happening down there. And that issues are increased risk of infections, incontinence, urgency symptoms, and UTIs, and discomfort and pain and difficulty with sex and loss of pleasure. So we have to address this. Vaginal health, pelvic health, is necessary for optimal health. 100% necessary for optimal health. And it's so critical. The more I understand this, and as we start to tiptoe into research in this area, it is profound how much we can help our patients by doing this. And this is an area I've been very interested in since early in the late 1990s, 1999. a woman came into my medical practice. I was fresh out of residency at Emory University, and she was a 63-year-old woman who had a history of ductal carcinoma in situ. She was 5'10", 155 pounds, striking, salt and pepper hair, black horn rimmed glasses. And she came in towering over me. She says, Dr. Annam, I was diagnosed with DCIS. I'm 63. I love my husband. It hurts to have sex. This is a really big issue. They won't give me any hormones, any estrogen, anything at all, and it hurts every time we do. And I'm a woman of the 60s. I'd rather die than live this way. Help me, right? Help me. And so I went to the research, and with her, because she was the president of a biotech firm, she brought me a lot of research. Thank God for patients willing to advocate for themselves. May they all do this. And so as I learned about, yeah, I can use DHEA safely in clients with breast cancer. And she didn't have breast cancer, she had DCIS, but she was treated as if she had breast cancer. And again, I've since seen, I would say in the thousands of patients with breast cancer since. So, so I looked at what can we do safely? And and through topical hormone application and balancing hormones safely and supporting adrenals, detox, decreasing inflammation, increasing insulin sensitivity, all those symptoms went away. And I tell you that at 73, her bones were as good as they were at 63. And at 83, she was publishing her memoirs. So that's the power. That's the power of what we can do. And don't let age be a limiter. Do not discriminate based on age, right? And so, really, I can take a woman from vaginal atrophy. You see the loss of blood vessels, loss of protective mucosa, loss of the elasticity and the rugation of the vagina, and the glandular secretion, loss of this, because what's happening in the vagina is happening in the urethra. Remember that. It's happening in the vagina, it's happening in the urethra. And we hear a lot about vaginal estrogen, but estrogen only works on this top layer, the mucosal layer. DHEA and testosterone works on all three layers, all the way to the muscularis. And that creates that. I mean, I have women in their 70s that like to boast they have the vagina of a 25-year-old. So that's a fact. That's so important. Now it's not it's an important piece for intimacy, pleasure, no partner, no problem, right? Pleasure is our birthright, and the clitoris itself has 9,000, 10,000 nerve endings, and that will atrophy, that will shrink and lose blood supply unless we're adding additional topical hormones to this. And that's one of the reasons I created my product, Julva, with plant stem cells and DHEA and an emollient base that's specifically designed, patented to really help us, let's say, age gracefully. Okay. So we want to address these issues. I say we use this clitoris to anus, address the external as well as the internal for sure. But it's important to address this because many women will come in and say, well, I'm not sexually active. That doesn't bother me anymore. And this is why it bothers me. I'll show you. As we get into postmenopause and we lose the natural hormone secretions, glandular secretions, the pH starts to get more alkaline. So you get a dysbiosis in the vagina. Now, this is really important. Hold on, let me see if I have that slide. One second. I want to show you this. This is so important because I had a patient who was 72 years old, and well, she wasn't a patient yet. So I'd known her for several years, and she'd been seeing some of the best hormone providers in the Dallas area. And she was, she knew her nutrition. She exercised at the gym 5 days a week. She had a great, enviable, to be honest, sex life. And she called me one day, March of 2023, and she said, Dr. Anna, um, I'm having spotting, and they keep adjusting my hormones. And I said, first off, what did the pap smear show? What did the vaginal ultrasound show? And they said, well, they thought it was because of the hormones. They haven't done that yet. I said, you need to get in and do that right away. She had stage 4 cervical cancer. So people who, that's another reason why it doesn't matter how old you are. I am going to want a pap smear at least periodically on you, and definitely do a pelvic exam at least every 1 to 2 years. But I want you to know yourself. So stage 4, completely preventable, right? Because are people asking a 72-year-old, do you have a new sexual partner? You could have been exposed to HPV. Do we care? No, let's just give you hormones. That is so painful when I hear things like that. So none of us here, you know, will do that. And definitely, even though guidelines say, oh well, um, you don't need a pap smear after so many years, Medicare will pay for it even every 1 to 2 years. And if we've been with one partner all our life, never had any infections or disease, maybe we can reduce screening, but never leave it unscreened. Vaginal cancers, vulvar cancers, cervical cancers are a reality, especially when we're not addressing the microbiome, the vaginal pH, and the hormones of the vagina and the vulvar area. So this graph shows that in cases of normal lactobacilli, healthy healthy epithelium of the cervix, and acidic urine pH. So the pH of the vagina is 3.5 to 4.5, and you have good microbiome, a good vaginal microbiome. You have a very low risk of HPV and low risk of cervical cancer. But as the vaginal pH increases, and you get more dysbiotic, the vaginal microbiome becomes more dysbiotic, less lactobacilli species, you have an increased risk of abnormal, so say cervical dysplasia and cervical cancer. And this is so important to me. And then understanding also, I'm going to jump around a little bit here. If we look at the urethra, you get atrophy of the periurethral glands, just like you get atrophy of the vaginal glands. And so addressing, and the same bacteria that populate the vaginal area populates the urethra. The Lactobacilli crispatus, Einers, um, Gasseri, and Gensi, and Rhamnosus. And that's critically important to protect the vaginal and bladder health. And that's something because I've been using when I initially retired, I'm back in practice for a few years now, but when I initially retired in 2014, 2015, my patients were like, Dr. Anna, no one will get give us your creams, lotions, and potions, because I've been really working on compounding special topical, and vaginal hormone combinations for patients. And so that's when I said I will create something over the counter that's better than anything that I can write on a prescription. And that is true to date. That is my Jolva product. And so I've had clients since that came to market in 2016. And I've had clients who have been on Njolva since then, and adding a vaginally targeted probiotic, bladder and vaginal health targeted probiotic, they feel even better, because what I found through testing, we can test the vaginal microbiome now. 10 years ago, we only were, I mean, even 3 years ago, we were only testing for sexually transmitted infections. We're looking at bacterial vaginosis. We're looking for trichomonas, chlamydia, gonorrhea, herpes, HPV, but we weren't looking at lactobacilli. We weren't looking at the healthy flora. This is the difference. This is game changing. And as I started studying it in my patients, I'd find zero, whether they were in their 30s, whether they were in their 50s, 60s. There was, again, because antibiotics you know, are abundant. The endocrine disruptors in body washes, the tampons and chemicals in our detergent, all of that affects the healthy protective layer of the vaginal and bladder microbiome. So by replacing it, by adding in these specific targeted species, and that's now I created the VB probiotic, and so that has it in there, and it's game changing. And yeah, so that this when we look at holistically thinking, okay, balancing hormones, for me it's the ketogene lifestyle, it's adaptogenic support. It's, during that, as soon as we can start supporting the adrenals. For me, that's the Mighty Maca superfood formulation. That is part of my foundations for clients. you know that is key. There's nothing, in my opinion, better. So there's the Mighty Maca Super 30 superfood combination, and then start really focusing on that ketogene lifestyle, following some of those medicinal menus, adding a fermented food, high quality protein, healthy fats, lots of alkalinizing sprouts or microgreens. Like that's a complete meal. Let me give you an example. Think again, I'm traveling. I'm in a horse trailer because my daughter's competing in the Texas State Rodeo. She's one of the finalists, and so we're here in Abilene, Texas, all week, and staying in living quarters of a trailer. So I have a small fridge, but what do I have? I was able to get arugula. I was able to get some blueberries. I was able to get some organic chicken. I brought it with me, actually, organic chicken and roast, and some a dairy-free yogurt. And what else? We're thinking an avocado and olive oil and some Oric sea salt. And so, like, very limited, but even here camping, I can maintain ketogene for the most part. And you paying attention to these things can make a really big difference. So think of smoked salmon with capers and red onions, drizzle on a bed of arugula, or wild greens. Add some sprouts, fermented food or sauerkraut on the sides. The capers are also fermented, so that counts. And drizzle it with olive oil and a slice of avocado, and you've got a perfect ketogene meal, right? So it's easy, it's medicinal, it's low inflammatory, healthy fats, high quality protein, supporting the gut microbiome, adding in that fiber and fermented food. So it's so good for us. It's so good for us. And so that's the other piece. And I do have the ketogene shake, which is 0 grams sugar. It was really important for me to have an option for my clients. And then there is then the supporting Jolva. For me, that's essential. So using that on the vulvar tissues. Lo and behold, it helps support your body's natural glandular secretions. DHEA has been studied also around the eyes. If you have clients if you're experiencing dry eyes, you can tap a little bit around the eyes, and we've heard great things about it improving some of those symptoms too. Again, because it's working to help turn back the hands of time um, on your tissues. So there's that. And then the balance cream, which is the progesterone and pregnenolone, and that's key. And the VB probiotic, I think all of us need to do at least 2 months of it periodically, because as I've tested, I don't see it. I don't see it. And if we have killed off that protective bacteria, we set ourselves up for odor, infection, UTIs, et cetera. So repopulating, that's a big piece of it. And then I just added my aloe hyaluronan based lubricant, which is microbiome friendly, pH balanced, and water based. And so it doesn't disturb the vaginal microbiome, because again, intimacy and sexual health is really important for oxytocin producing production. So that's a really important piece. And I don't want anything to disturb the microbiome. I even use it during my exams and have been for the last year, because I was like, as you look at ingredients, you start to become an ingredient a snob. I don't even want that for my ultrasound, for my pelvic exams. So Velvet is really good, and it can be used over like red light vaginal wands and things like that. It's a very, very safe thing to use. So the kind of thinking of the addressing the inside out and the outside in. This is really important because people can be on hormones, but if you're not using it in the vulvar vaginal area, you're missing out. You really are. You're missing out on the good benefits. And one of my clients who have said when they added the VB probiotic to using Jolva, it further decreased not getting up at night to urinate, no more urinary tract infections. And this is just that piece. Again, we have to repopulate the good, the front line defense, and that's our lactobacilli. Um, yeah, so I'm very passionate about this topic. and restoring our hormones again from the inside out and the outside in, and doing it from an integrative and functional approach. And the good news is it's all in our control. It's all in our control. I know I went on a little longer than that 10 minutes, Carrie, but
That's okay. I love that. And I think it's such a topic that we're not talking enough about. And I think there's a lot of shame that comes up for a lot of women, and we need to erase that shame and bring light to it. So I really respect that. We have, I think you'll like this. I may have told you this before, but in our house, we have a house full of boys, and they all know vulva is for your vulva. Like they have to be informed too. So that's a common conversation around here. We're seeing a ton of low progesterone, younger and younger all the time. Any specific insight, wisdom, or perspective there to share when you were talking about balance cream that came up for me?
yeah, yeah, definitely. So, get them on Mighty Maca. That's really important to support their adrenals. And it's the hormone disruptors that are in our environment. And I will say, the blue light toxicity from the phones is affecting everyone's hormones. There was a study done, I want to say it was in Japan, that looked at young men and their screen time versus their testosterone production. And they found the more screen time, the lower the testosterone. It's happening to men, it's happening to women too. And again, what's that higher level neuroprotective hormone? That's your progesterone and pregnenolone. So that's from the top. Stress, of course,
Hmm.
and just the hormone disruptors. And I have four daughters. So the what they're putting on their body, it's a lot more challenging. My youngest is 18. It's a lot more challenging with her now, but it used to be, and it, really easy to avoid all those hormone disruptors in my kids' products. So, but there's the Yuka app, so there's easy ways to scan barcodes. We were just at the local Walmart here, stocking up the horse trailer, and didn't bring shampoo. So she's scanning all the shampoo bottles, saying, "Oh, mom, I thought native was good." And she's like, "Oh, that doesn't rate as well." And so we're scanning everything. So kids need to become aware of that. The other thing she told me, because PMS is really common in girls, she told like she's like, "Mom, I'm the only one of my friends that doesn't have problems with their periods." I said, "This is because you drink Mighty Maca, you have clean organic food at home, and that makes a difference." Not always the case, but the majority we can do that is going to help balance their hormones better. And I think this generation, like, are starting to pay attention to it
Yeah. I
more than we did.
We need to be doing a better job of that for the younger ones. On the Mighty Maca. I'm glad you said that. That's really important to help detoxify with the spirulina and chlorella in it and help them meet
Milk
your.
thistle supporting the liver and
Yep.
supporting the adrenals. There's the adaptogen. So you have the maca as adrenal adaptogen, turmeric, quercetin, resveratrol, all adaptogenic. So yeah, I mean, feel safe enough. My granddaughter, who's 4 now, has been drinking it since she was one and a
I
half.
remember you saying that. That's so cute. I love
She's
that.
like my biggest fan. She loves it. And I feel good about her drinking it.
Absolutely. Okay.
Yeah,
I have a 9-month-old granddaughter, and yeah, that's we will have to start to implement that. All right, what
after
question?
a year. Yeah.
Right. Okay, after a year. Okay, good to know. What questions do y'all have on the call? There are lots of friends here. If you guys want to pipe in, please unmute yourself. Feel free to ask
You
questions.
can seriously ask me anything. You're in a safe space.
Sure.
It's hard, like talking about vaginal health, vulvar health, bladder health. I mean, just put in the chat. Did I teach you anything? Do you guys have a new perspective? Do you have a right next step? Just put a Y in the chat. Let me know you have an action. You're going to take action on at least one of the things that I talked about today. And I think, especially as a provider too, and I train so many other providers, is just being able to have conversations, the importance of pelvic health and vaginal health. And that's key. All right, Juna.
Hi, I don't have a question, but I just wanted to say I'm a big fan. I listened to your podcast, I've read your book, I use Mighty Maca, and I just wanted to thank you.
Oh, thank you. Thanks for popping on. I'm so excited you're out there in nature walking. Oh,
Hi.
so good. Now take off your sunglasses if you can.
Yeah, they're actually glasses.
Okay, yeah.
I try to
I,
take them off for a few minutes, but yeah,
yeah. Jack Cruz told me to put him down
yeah.
at the lower bridge of my nose so you can get the benefit of all that good sunlight and sunset coming on around you.
All right.
Thank you, Jonah.
Thanks.
Super important. But there's so much value in daylight.
We get more than vitamin D from the sun, right? We get more than vitamin D from the sun. And remember, like, there's always one next right step we can take, and everything we do, from the thoughts to what we put on our body, in our body, in our mouths, is working towards health or working towards disease. So, every minute we get to make a new choice and become the person who is active outside, enjoying themselves, right? Smile on their face, experiencing longevity. I think that's so important. I had the blessing this morning of, well, I had to take my dog, my small 13-year-old Australian Shepherd, to the vet this morning. And it's a local town. I'm in Abilene, Texas. So I met this veterinarian, 93 years old. He's been practicing for 70 years,
Mm.
70 years. And he, had this lovely conversation. He goes, yeah, he goes, my friends at 68, 69 retired, and in one year they were dead. They just sit on the couch, watch TV, and in one year they were dead, right? And so he's 93, still working. And it's just like he works half days. He works mornings from 7:30 to 12 o'clock every day. I love
Oh,
that. I
yeah.
love that.
Yes. My mom, Sherry Clary, she's
Oh,
70, she's turning 71 this year. And I say that all the time. She lives in Florida by herself on her own, lives an incredibly vibrant life. And then I watch others in my life around the same age, and I'm like, this is night and day. I
night
think
and
it
day.
has so much to do with getting up and having purpose and some structure to her day and being able to help others. And there's a lot to be said. I feel very blessed to have a mom that's living that lifestyle that I get to, watch and be witness to and learn from. So,
A true role model, a true trailblazer and role model. That's awesome.
yeah.
Exactly. Yeah.
All right. Anybody else, any other questions? Otherwise, we can wrap it up. And again, I'm so grateful for all that you pour into um, women's health, and we wouldn't know what to do without you in our office. It's been such a huge blessing to work with you guys and your team, and
We feel
super
the same. We feel the
grateful.
same, like-minded.
Yes,
Thank you.
ma'am. Yeah. All right. Well, have so much fun and good luck to your daughter.
Thank
Um,
you.
yeah, that's such an exciting time.
Yep, I'm so excited. So I look forward to it. Thank you so much for having me on. And God bless you all. I appreciate you. And thank you, Carrie. If any other follow-up questions, let me know.
Okay. All right. Have a
Okay.
great night. Thanks, everybody. Bye-bye.
Thank you.